not like that across the U.S., however. That's why Organizing for America is taking its message on the road. Some Democrats are getting soft on this. As you know, Senator Bingaman has been talking with a group of Democrats and Republicans in Washington on the Finance Committee. The senator didn't have to meet with his colleagues. He could have sidestepped this and stepped back and said, I did what I wanted to do on the Help Committee. However, he decided to join him and see what options are available in case all the Dems won't vote for health care reform. He's a progressive at the table, trying to find a way to get health care coverage for all of us, trying to make sure we can cover all Americans in this historic opportunity. Folks, we need to work together to advance President Obama's vision for health care reform in this country. We need your support now and in the future. We have to keep health care reform on track. Please, talk to your neighbors and friends. Ask them what they're worried about. Give them knowledge. Counter the lies that the opponents of health care reform are spending. Ask them what they're worried about. Allay their fears. Convince them that we can do this together as a nation for our nation. Let me close with a few more questions for you. We want to stop insurance companies from discriminating against people with pre-existing conditions now. Yes. We want to end costly co-pays and high deductibles. Yes. How about no or low co-pays for preventative care? Yes. Right. Should we end annual and lifetime caps that corporate bureaucrats don't get between patients and their treatment?
Yeah.
Is now the time to pass comprehensive health care reform? Yeah. The time to fight for it now? Yeah. Can we redouble our efforts? Yeah. Yes, we can. Thank you all. Good night.
Under health care insurance reform, insurance companies will be prevented from placing annual or lifetime caps on coverage you may receive. Insurance companies will also have to abide by yearly limits on how much they can charge out-of-pocket expenses, helping over 6,000 households in New Mexico struggling under the burden of high healthcare expenditures. That's what healthcare reform does for us here in New Mexico. An individual who's seen these effects on our families day in and day out, Dr. Tony Lewis, throughout her medical training, has been involved in advocating for resident physician rights and improved patient care. She has served with the Committee of Interns and Residents of SEIU Healthcare since the beginning of her training as a department representative, delegate, New York Regional Vice President, Executive Vice President, and since December of 2007 as National President. Dr. Lewis also serves on the Division Leadership Board of SEIU Healthcare and the International Executive Board of Service Employees International. She was named a lead advocate for healthcare in the United States and is a national advocacy organization. With that being said, Dr. Tony Lewis.
Good evening, New Mexico. How y'all doing? So yes, I'm a family practitioner and geriatrician in New York, and it's important to be here in New Mexico right now because you all know what's going on, is that right? And you all are the change that we're waiting for, right? You're gonna make it happen. So yes, so I represent 13,000 doctors across the country and also with SEIU 2 million members, hard-working people. But you guys know it's time for a change. And it's time for comprehensive, affordable health care for all. And it's time for a robust public health insurance option. We're gonna get that done. So I think it's entirely appropriate that the winds are blowing right now because we are the winds of change. Do you feel that? We're gonna make that change. And so, you know, from our perspective, from the millions of hard-working people across the country and from the doctors on the front lines, we see all of these things that are going wrong. We know the status quo does not work, and you guys know that the stories are not stories, they are people. They are your family members, your daughters, your children, everyone. And I'm gonna tell one quick story. We have many surgeons that have people come in with really terrible wounds, and they were afraid to see doctors for years because they thought it would bankrupt their family. Now, does that make any sense? No, we are going to change that in every other horrible story that we know. So thank you, Organizing for America. Thank you for getting out there. So let's talk about myths. Do you think, let's see, is it time for health care now? It's time for health care now. One of the myths is that seniors will lose Medicare and it will cut money. Is that right? No, if you are a senior, you are able to keep your benefits. We will keep our seniors strong because they are important to us. Now, do you think it's right that health care reform will get in between you and your doctor? No, that's not what will happen. We've both told stories about how what the status quo is doing right now is getting in between us and our patients, and that's not right. Healthcare reform will sweep all of that out of the way so that we can get about being healthy, strong Americans, healthy, strong people, strong New Mexico, a strong country. So in the interest of time, you guys know what needs to be done, is that right? I saw Kennedy Care up there. I see Standing Together for Healthcare Reform over here, and I see thank you. I see thank you. Thank you all. And let's keep everybody's feet to the fire and get this done when? When?